Well, thanks so much for joining me today. New research by secondstreet.org found that there are just under 1,900 Ontario nurses who regularly commute to Michigan to work in the American healthcare system. Today, I'm pleased to talk with a nurse who's done just that for a lot of years. Thanks to Liz McDowell from Windsor for joining me. Liz, it's great to have you here.
Thank you. Good to be there.
Let's just start with a quick bit of background. So you worked in the Canadian system before starting in the US, right?
Correct. For about 15 years.
About 15 years in the Canadian system. And so you've been a nurse for how long?
50 years.
50 years, gotcha. And I know you were telling me when we chatted the other day, you've bounced back and forth between a lot of different positions in the nursing world, right?
Oh, yeah, for sure.
Okay. So why don't you tell me about the main reasons that you decided to start working in the U.S. instead of in Canada?
Um, well, I worked over here, as I say, for about 15 years. Everything seemed good. I had come from Toronto to move down to Windsor to go back to school. And when I was faced with wanting to move to a different position, um, unfortunately wasn't considered for the position. And it kind of bothered me to the point that the whole point of going back to school was to be able to have that option. So I was allowed that opportunity. I wrote my board exams for the US and did go over there, and it did. It afforded me many more choices than what I was able to have in Canada.
Yeah, that's something that we heard a lot in that survey we sent out was that it was availability of work up here in Canada was quite the
Yeah.
challenge.
Yeah, there might be some part-time positions or contingent positions, but for young for young nurses looking for a job, yeah, there's just you've got the University of Windsor and St. Clair College churning out nurses, and you really only have two hospitals here. So if you want a specific area and or you want full-time position, for a lot of nurses, that's their only choice is to go across.
And I imagine crossing the border every day. I have no idea what that would be like. When you cross the border, you have to deal with your car getting searched, facing a long lineup. I mean, what does the typical shift look like?
Well, things have changed a lot over the years. Again, you start thinking about 1987, which is when I first started going over it. It was very laid back, going back and forth, and you really needed all you needed was your driver's license and or birth certificate. No big deal about a passport or anything else. Well, then after 9/11, the paperwork really intensified. But especially border cities like Windsor, Niagara Falls, different areas along the border, you always have a fair number of people crossing the border for work. So they came up with a trusted travelers program called Nexus. And so that really streamlined the process. So it got away from the long lines because you're basically pre-checked. They've done the police clearance, all of those kind of things. You get searched, but it's on a random basis, probably about once every 4 to 5 months. If they find something, well, then you could lose that privilege. But again, if you've got a job and you're going back and forth, nobody's going to risk that. So nowadays, the biggest issue is yes, there's a lot of paperwork because you do need a passport, you do need something like a Nexus card. That's extra paperwork. Once it's in place, it's really not difficult. It's just like traveling for me when I came back to work in Canada. It's just traffic, and quite honestly, it moves smoother and faster. I can get to Henry Ford in Detroit faster than I can get to Windsor Regional from out here in the county.
Okay, okay. I imagine there's probably a bit of a cost too, hey, to getting all your paperwork and
Um,
crossing the bridge.
uh, yeah, there is a cost, but most of the hospitals are going to cover that.
Hmm.
They will reimburse you for your visa screen and all those kind of things. The other issue was I had to pay for parking in Windsor. Didn't have to pay for it in the States, but I had the toll every day.
Hmm.
Again, because you're a frequent person, you could go into either the bridge or the tunnel and they have a lower rate if you're a frequent user. So it worked out to be about the same as paying for your parking here in Windsor.
Okay. Okay. So currently, and just to make sure I've got this correct, you are still working for the American system, but remotely from home, right?
Correct.
That's
That's
right.
correct.
So I guess just in all of your years doing a crossing into Detroit, how did you find working in the U.S.? What is the difference from working in Canada?
The biggest difference is choice. Like I say, if there's something that I wanted to pursue in terms of a job, if I had the qualifications free to, apply and good chance of getting it versus Windsor, it had all to do with seniority, what was available. You had to wait for somebody to die or transfer for anything to open up. And you never knew when that was going to be. When you start talking about an institution like Henry Ford with 1,000 beds, yeah, there was lots of positions all the time because people are coming and going. Um, a lot friendlier and a lot nicer in the US than here. Unfortunate to say. And again, that's my personal opinion is it has to do with nurses doing what is they want to do versus what they're allowed to do. So that's probably the biggest. Plus, I had come from a teaching hospital. And I really like the teaching hospital environment.
Okay, interesting. So, one thing that has been, a lot of governments have been moving towards contracting out private clinics to
Mhm.
try and reduce the surgical backlog. A couple months ago, Premier Ford in Ontario said that specifically for cataract surgeries, they're really going to look towards moving towards, paying private clinics with taxpayer dollars. So, if there were a clinic or a hospital to open up in Windsor that was, the kind of job that you were interested in, would you consider working there?
Absolutely, absolutely.
Okay.
Again, it's if that's what you choose to do and it becomes available, I don't think you'd have any problem staffing it whatsoever because, again, it's number one, it's specialty training, and that always allows you then a leg into, other positions, say you wanted in the hospital, because you've got that background. It would afford you that kind of special training. But yeah, if that was what I wanted to do, I would definitely work in one of those positions.
Okay, okay. So you think it's more about the specialty aspect of it. They're able to provide jobs that nurses who are currently commuting would like to have.
Possibly, yeah,
Yeah.
absolutely.
Okay. So in your experience, in our survey, we found out that, or our report, we found out that there are about 1,900 or so nurses currently commuting down to Michigan from Ontario. But in your experience over all the years, is it pretty common for Canadian nurses and doctors to work down in the U.S.?
Oh, yes, absolutely. As I mentioned, I had at one point worked and was managing orthopedic services at a hospital in downtown area, and it was a new service, so I had very minimal staff. And so when I started the floor, I had a lot of travel nurses, and they were pulling nurses from other floors. So I had a lot of positions open, and it was one of those things. I had a few Canadian nurses on the unit at the time. They liked how things were going and where it was headed, and the next thing you know, we had the dubious honor of having the only unit at that particular hospital that had um, all Canadian nurses. And I had one token American nurse on the unit out of 35 nurses. So it was word of mouth, and just, again, they were looking for a job, and we ended up, it It was weird, but we ended up with almost all Canadian nurses on that unit.
Wow, wow.
Wasn't something that I was trying to do, but that's, so.
Yeah, yeah. Well, that's a pretty interesting story for sure. Um, it's I think I've pretty well touched on all of the big points. Are there any other big takeaways from your experiences that you think could be used to improve the Canadian system and help attract more nurses to stay in our country?
Um, I think, again, my personal opinion over all these years, um, one of the things that's always an issue is staffing levels. And of course, you've got the unions take on it, and you've got the hospitals take on it. But more to the point is equipment and having to work with outdated and minimal equipment here in Canada. We really neglected the infrastructure of hospitals for a very long time. And, again, my personal belief, it has a lot to do with political, who's in power at the time. And if your area does not support that group, you may or may not get the equipment. And so at this point, we're poking fingers into holes, trying to keep the whole thing functioning. And it's really has been in dire need of new and better equipment. Maybe these different small privatized and or government supported independent surgical areas will help with that, because then you can focus some of the equipment there instead of it coming out of the hospital's major budget to try and, well, that's not the most important thing we're looking at right now. So I, again, got very used to hearing that all the time. Wasn't prioritized high enough, so you had to do without. And I think a lot of nurses will tell you that there's endless frustration with that. You don't seem to run into that in the US side the same way. Their reimbursement, although really complicated, they do support their hospitals, and they do very well.
Mm. Okay. Well, anything else at all that you think I should know, Liz?
No, I think that's pretty much it. Covered everything that you had sent. So
Great, great. Well, thank you so much for taking the time out of your day to come and share some of your experience and some of your knowledge on that. I really appreciate it, and you have yourself a great day, Liz.
yes, you too. Thank you.
Thanks.